Okay, hopefully we can hear this one. I tried again with the new sound. So if you guys get a chance to tune in, just give me a thumbs up if you can hear the sound. A lot of you guys are, yay, works. Rita, you can hear me? Hi, Beth. Okay, fantastic. I think the sound is working. We've had some technical difficulties. Thank you all for hanging in there. You can hear me? Okay, great. So let me talk to you guys about what I want to share with you guys is some of my experience working with patients suffering from Hashimoto's and what happens with viruses. So one of the biggest things that we know is taking place is a lot of people are very worried and very concerned that are they immune compromised because they have Hashimoto's, and this is something that we really need to discuss. And I want to share with you some of the clinical perspectives. So for me, my background is I have a PhD in health science. My concentration was in immunology, and I'm a member of the American Association of Immunologists, is where you have to have a immunology and a doctoral program and publish papers to be accepted as an immunologist. So I have some experience. However, I'm not a virologist, and I can't really give you the depth that you can get from experts at the CDC regarding virology aspects. And I don't have an expertise in parvovirus. I don't think anyone really does at this point. It's a new virus, so I can't really give too much information about parvovirus specifically to Hashimoto's because we really just don't know. But I am going to talk to you guys about how viruses in general impact autoimmune Hashimoto's so you can have some general ideas. Now, the first question that comes up with a lot of people that have Hashimoto's is, are they at risk? Are they immune compromised? So let me explain a few things. When you're looking at autoimmunity, one of the first things to understand is that every person has autoimmunity has different degrees of immune integrity and immune status. So, one of the things that we routinely do with patients suffering from Hashimoto's is just run a complete blood profile and just look at the basics of what's happening to their overall metabolism and their immune function. And if you have some of your own blood work, you can take a look at it and look at your red blood cell, white blood cell section, the CBC, and just look at your total white blood cell count. And if that total white blood cell count is within normal reference range, then you have an immune system that, despite the fact you have autoimmunity and there's antibodies attacking your own tissue, then you have an immune system that is fit, that is healthy, that it's not immune compromised. So from a clinical standard of definition of immune compromised, the most accepted area to look at is your total white blood cell count. Now, some patients with autoimmunity have a total white blood cell count that's low, and some patients with autoimmunity have a total white blood cell count that's above in the normal reference range. It's pretty rare to see a total white blood cell count outside the lab range unless the person actually has an infection of some kind. So that being said, they express immune compromise. Their autoimmunity is so progressed, and you look at the white blood cell count and you see the white blood count is like 2.8, and that person will be at risk for infections of all kinds, and their immune system is totally compromised from their autoimmunity. Now, the good news is it's not common to see that. With many patients with autoimmunity, you actually do see the white blood cell counts within the normal system, within the normal range. Now, the other thing to know is that when people have autoimmunity, there are some people that come in with histories of one version is of a common history is, since I got diagnosed with autoimmunity, I haven't caught a common cold or the flu for the past 5-10 years. And in some cases, when people have autoimmunity, their immune system is so overzealous that their T cells are so active and so aggressive that they just don't get common infections. As a matter of fact, when people are fighting one virus, like if they had influenza virus, it's pretty unlikely that they can get another virus on top of it. So many expert virologists, which I'm not, but many expert virologists find that if you already are suffering from, let's say, influenza, it's less likely you would get something like coronavirus during the time of your infection because your immune system is already elevated. So when you look at the autoimmunity and the risk for getting infections, one of the key things is every person with autoimmunity has a different immune status. So having Hashimoto's is not specific enough. Every person with Hashimoto's has different immune integrity. So you want to take a look at your total white blood cell count and your past lab records, lab tests, and see where you are. Okay. Now, you can't say that when you're looking at how do you optimize your immune system, what kind of things do you do when you look at autoimmunity, and where does coronavirus come in, and how does this work? Well, let me teach you guys some general concepts about viruses first. When you look at a virus, each virus has its own gene type, and then each person, the host, has their own gene type. So the combination of certain viral strains with a combination of certain gene types can really have an impact of how the person will react to the virus. So one of the most well-known viruses is hepatitis C. And with hepatitis C, when someone gets the infection, some of the hepatitis C variants will cause a person with a certain genotype, their own genetic makeup, the host genetic makeup, to end up with liver failure. And other people have actually no symptoms, but just an abnormal antibody count. So one of the things you have to understand is we don't really know with parvovirus. Well, we know there's a couple strain, there's a European strain and a Chinese strain so far. And there hasn't been much difference in pathogenicity of those two viruses that have really been established yet. But we know that there's some people who will get really sick and some people who don't. And it may not all just be immune compromised. So sometimes the genotype of the person plus the virus is really what determines how aggressive the virus can become. We know there's risk factors with most viruses of just being elderly, having a compromised immune system. That's one of the variables, but genes is another one. So that's one thing to keep in mind. Now, when people get chronic infections like hepatitis C, one of the things that happens to them is they'll get a viral genotype test to see which type of hep C genotype they have, and then they can compare it with the risk of how much fibrosis they get, and they get a big clue of what's happening to that response. Now, with parvovirus, over time, the genotype may change. There could be different strains. As we get worldwide immunity, it may completely resolve. We don't know what that's happening. So in general, when we get a new virus that impacts our human species in general, one of the things that we're looking at is how quickly that virus can mutate and change. Like influenza is one of these viruses that quickly mutates and changes. The general strains of influenza we get every year because this virus is mutating, and this is why we deal with it every year we have flu season. Some viruses have very little mutations and change, and once we get immunity to it, we don't really have any significant reactions. Now, one of the viruses, for example, that has been shown to be triggered for Hashimoto is the cytomegalovirus. And when you test cytomegalovirus in the worldwide population, virtually everyone has antibodies to cytomegalovirus. And even Epstein-Barr, 90% of the population has antibodies to Epstein-Barr virus. So we have these viruses that we get exposed to, but our immune systems over time become fit to not let them express. And it would only take something like a significant immune trigger to let these dormant viruses become active. So we're not really sure what happens with what parvovirus is going to do and how it's going to impact autoimmunity. That's one of the first things. And when you also look at viruses and you look at what it does to autoimmunity, there's a couple concepts I should really share with you before I go into some questions. One of the main concepts is something called molecular mimicry. And we know that Epstein-Barr virus, cytomegalovirus, hepatitis C virus, herpes virus can all have some molecular mimicry reactions with Hashimoto's. What that means is when you get exposed to a virus, you make antibodies, and then those antibodies bind to a protein sequence, an amino acid sequence of the virus, and that antibody allows the immune system to find that virus and destroy it. So in some cases, there's something called molecular mimicry, where the antibody you make for the virus, those antibody sequences of the proteins they attach to are similar to self-tissue. So when you make antibodies against the virus, it can actually bind to the person's own tissue and cause a reaction. A great example of that in the literature is hepatitis C virus. So if a person gets hepatitis C virus, they can make antibodies to hepatitis C, but those antibodies for hepatitis C not only attach to the virus, but they've been also shown to attach to the thyroid gland. So some people, when their hepatitis C flares up, their Hashimoto's thyroiditis flares up. So we don't really know if this new virus is going to have molecular mimicry with any autoimmune tissues or any autoimmune glands. It's always a possibility for some viruses to have what's called molecular mimicry. That time will tell. And then when you're looking at other mechanisms of how viruses can trigger autoimmunity besides molecular mimicry, another one is called epitope spreading. This is a concept in immunology where the virus infection gets into the tissue and then it starts to cause an inflammatory response. That inflammatory response in the tissue causes tissues to break down, which then creates new autoimmune target sites. So for example, if you have Hashimoto's, you have antibodies to the enzymes TPO, and you also have it to potentially thyroglobulin. However, if the inflammation, the virus gets into the thyroid gland itself, then that tissue breakdown can then cause antibodies to actual follicular thyrocytes, or it can actually cause autoimmunity to actual T3 and T4. That's called epitope spreading. What we don't know about this virus, parvovirus, for example, is does it actually get into the thyroid gland? If it does, it would probably cause a lot of painful thyroiditis symptoms, which would be pain and swelling of the thyroid. There's no reports of that yet, so it's unlikely that this current virus is getting into any kind of glands like the thyroid. So it may just be a systemic issue. More than likely, there's no molecular mimicry, there's no bystander activation, there's no epitope spreading. But those are things that are there. So let me try to answer some of your questions. I just want to give you some background at first. So I'm sorry, I'm saying parvovirus instead of coronavirus. Let me get into some basic questions here. So thank you everyone for your nice welcomes. And let me see if we have some questions here. So question from Judy, if your white blood cell count is low, whoops, let's go by quick. Sorry, I'm not used to doing live Facebook. Okay, so if your white blood cell count's low, what do you do? So if your white blood cell count is below the low end of the range, what can you do to improve it? So this is also something I want to talk to you about, is this immune resilience. How do you build your immune resilience? So for my subscribers, I created a program called Everyday Immune Resilience on Dr. K News. That if you're on our email list, you'll get it. But I'm going to share with you all the concepts right now, so you don't need to, be deprived of any information. Number one thing you can do if you're trying to improve your immune resilience is to really make sure that you get proper sleep. And people hear this and people think they understand that, but let me explain to you what that means. Proper sleep means, first of all, adequate sleep or ideal sleep would require, number one, you just wake up when you're no longer tired. That's the first thing. So if you're immune compromised, your white blood cell count's low, you're worried about getting the infection, then one of the most important things, I actually probably will say the most important thing, is to get proper sleep. So proper sleep would mean you just wake up when you're not tired. If your alarm clock is waking you up, if something's waking up every morning, you're not sure if you got enough sleep, that's not ideal sleep. So you really want to make sure that you get ideal sleep, that you put yourself in a situation where your body just wakes up when it can, if you're dealing with trying to improve your immunity. Now, the common mistakes people make is just go to bed too late. I mean, they just stay up watching a TV show or doing things or getting on the internet and not getting a chance to get proper amount of sleep, so they never really let their body just wake up on their own. So for a lot of people, that just mean going to bed earlier. So one of the things that we know about sleep is that when you're actually asleep, you're actually releasing peptides and things like melatonin and different types of immune modulator proteins that prime your immune cells. So when you're asleep, your immune cells are actually developing natural killer cell responses. Their T cells are becoming stronger. And if any of you have noticed, if you ever missed some sleep, like if you had 3 hours of sleep one night, it's very likely that you may get the common cold that's passing around. So it's critical night by night that you get proper sleep. Losing one night's sleep can impact your immune system and make you vulnerable for infection the next day. So that is absolutely critical. Now, with my clinical background, working with patients, for example, that have chronic hepatitis C that are looking for diet, nutrition, lifestyle approaches to keep their viral load down, I mean, we can put them on handfuls and handfuls of supplements and get them off all these inflammatory foods and give them tons of antioxidants, but nothing changes in their viral load activity when we measure it with labs until they sleep. So I'm pretty much convinced if you're dealing with a virus or having immune compromise at this point, after over 20 years working with chronic autoimmune patients and chronic immune challenge patients, sleep is the most fundamental aspect. Now, a lot of people don't get proper sleep because they wake up in the middle of the night to urinate. If that's the case, there's a couple things you need to know. Number one, as you get older, your pelvic floor muscles do weaken. And if your pelvic floor muscles weaken, you're going to have an overactive bladder. There's going to be pressure being put against smooth muscles of your bladder, just being in that sleep position. And it's going to trigger you to have this urge to urinate frequently throughout the night. So pelvic floor exercises, even for 10 days, if you're having constant frequent urination, could be a good way to really see if that helps you. So, too much sodium intake at nighttime. If your dinner is really, really salty, that can also be the reason why you have frequent urination or wake up in the middle of the night, because you're trying to get rid of all that sodium and change that sodium concentration. So be aware of those things. Those are the two most common things that you'll see with people that have sleep issues. But the key thing is really just to make sure that you get proper sleep. You also want to get deep REM sleep. Deep REM sleep is very critical. Something that has helped a lot of people to get into deep REM sleep are white noise machines. There's a lot of good research on this. And white noise is like a fan going around, fan going off. There's different things you can get on Amazon that are machines that generate white noise. White noise isn't like rainfalls in the rainforest. That's just scattered noise. White noise is just a constant same frequency of sound that is being generated. The best example is a fan that's pretty consistent, same rhythm. There's no big pitches and spikes. Some of these audio sleep machines have like rainforest with all of a sudden a bird singing, and then that's not white noise. That's just scatter noise. But white noise, consistent sound is another great way to really get into deeper REM sleep. Some people need to use sound cancellation headphones to fall asleep, and some people sleep with them. Some people need earplugs, but getting proper sleep is really, really critical. Now, as far as melatonin goes, some people talk about taking immune supplements. Melatonin is an immune trigger, and for some people that take exogenous melatonin, especially with autoimmune disease, you got to be very careful. However, things like magnesium right before bedtime are pretty benign. Very unlikely that it'll be an immune trigger, so that could be something you can use to help you. Things like chamomile tea. So, if you're trying to improve your immune system, I can tell you, sleep is the most important thing to get fine-tuned. And if you get proper sleep, your immune system will dramatically change. Now, I can tell you also, working with autoimmune disease patients for many years, one of the tests that we used to do in the clinic was a test called natural killer cell activity. And the way this test works is the patient goes into the lab, they donate blood, or they submit their blood. When the blood goes to the laboratory, blood gets drawn out, they isolate natural killer cells, and they expose it to a compound, and they measure how active the natural killer cell can destroy the compound. It's called NK cell activity. And most people I saw with autoimmunity had very weak NK cell activity, natural killer cell activity. And natural killer cell activity not only helps fight viruses, but it's been shown to be not only killer cells, but immune modulators and autoimmune modulators. And one of the most profound things that impacts natural killer cells is really sleep. So back to sleep again. Okay, so that's the first thing I really want to make sure that you guys all really consider in trying to figure out strategies to make yourself sleep better and figure out why you're waking up in the middle of the night. That's important. Oh, one thing I didn't mention, another common reason where people have problems sleeping through the night is because they are hypoglycemic throughout the day. So if you get shaky, lightheaded, and irritable throughout the day, when you eat, you feel better, that's a sign too that you're really playing this blood sugar roller coaster ride. What's normal is when you eat, you're just no longer hungry, but there's no change in energy. But if you're going through the day and when you eat something, you feel like you can focus again, like you can think again, like you can concentrate it again, that's a sign that your blood sugar levels were too low. And if you're constantly going through the day with low blood sugars, then you're unable to make a storage form of glucose called glycogen that you store in your liver, which keeps you in a restful sleep state throughout the night. So one of the key things to also look at if you're not getting proper sleep is to really look at if you're letting your blood sugar levels drop throughout the day. For many people, once they have their blood sugar levels stop dropping throughout the day by just eating more frequently with proteins and fibers instead of sugars, then they'll be able to start to sleep again. Okay, let me go into some other questions. Again, so nice for everyone to say thank you to join. It's my pleasure to be here. Okay. Let's see. Sleeping early. Okay. What can we take for supplements, foods to strengthen our immune system? All right. I think the key thing to remember is there's a lot of stuff happening on the internet right now where people are coming in saying you can take one supplement or you can't take another supplement. Like some people will say you should take echinacea. And if you just look at echinacea from a research perspective, some of you are probably researchers or in the medical profession listening in, go on the National Library of Medicine and then type in echinacea and upper respiratory diseases. You can see about 12,000 studies. There could be more, but it's a high amount of studies. And they've done clinical trials with echinacea with different upper respiratory viruses, and they found that it's very helpful. And they've gone to the point where there's now several meta-analyses done. And meta-analyses when they take multiple clinical trials done, and then they combine the data together for what's called a composited score to see if this actually, do all the trials find the same thing? What's the average outcome? And what they find is that echinacea has been shown to help. But there's now people that are saying, well, echinacea can be harmful to you because it impacts this enzyme, and this enzyme is parvovirus, and it can make it trigger, and it can make it get worse. When I read these things, it's actually very frustrating because there's two things. Number one, it is possible that taking an immune supplement, especially if autoimmunity, can trigger your immune response and make you worse. But it's also possible that these things could be helpful. And the problem is that sometimes when people are commenting about vitamins like echinacea being okay, vitamin C being bad, they're looking at one, let's say, animal study with one single mechanism of an immune response and then trying to make some kind of assessment about that. They're speculating about what it can do. So I remember just reading some stuff that people say, oh, do not take vitamin C, it can flare parvovirus. And I was like, how do you know that? And they'll cite some weird enzyme and part of the immune response as this is what parvovirus uses to fight your body, and if you activate vitamin C, you'll make it worse. That is an absolutely total inability to understand how the immune system works. When you look at the immune system, you can't look at the immune system as one messenger system. It's kind of like if you're looking at a football game and watching football players, you can't just look at the quarterback. If all you did is look at the quarterback, you wouldn't understand what's happening. So there's a team of messenger pathways, there's a team of immune cells that are all working together. So I would say as far as supplements go, you're going to hear some very contradicting information out there about what to do for immune function and immune support. And some of it is, I think, intentionally scary. I think a lot of people are trying to shock people into not taking certain immune natural support supplements. And it is, but on the other hand, it is possible that some immune enhancing supplements can be a trigger for not just for coronavirus, but for Hashimoto's in general. So when you're looking at coronavirus, excuse me, sometimes I use parvovirus, it's just stuck in my head. I was reading a bunch of papers on it last night for other reasons, but when you look at coronavirus, we don't know if it's just related to, we don't know what the specific protocol is. No one really knows. At the end of the day, you have to decide what's best for yourself. Your practitioner has to know what's best for yourself. So, what kind of supplements you take. Now, I would say in general, when we look at patients that suffer from autoimmunity, typically things like vitamin D, vitamin A, vitamin C are very helpful. Vitamin C is a very powerful natural killer stimulator. It may be possible down the road they find some research that it may promote a viral response. That's very unlikely, but it is possible. So I think it's tough to comment about which supplements to take right now. you got to be very careful if you have autoimmunity to start taking a bunch of immune-enhancing supplements and herbs, because it may just flare up your autoimmunity. So now is not the time to really experiment with different herbal botanicals if you are trying to build your immunity, because it could be a trigger. Now, the other question was foods. The best foods for dealing with autoimmunity is basically healthy fruits and vegetables, real food, processed foods. Sugar is absolutely the worst thing. So there's been lots of research done on sugar, and sugar wipes out T cells. The sugar from like a diet soda, or even the sugar, especially concentrated sugars, for something very sweet, can really suppress T cell function, natural killer cell function, for 6 to 8 to 12 hours from one exposure. So you really want to, if you're at home and you're depressed, you definitely don't want to be on a sugar binge, because that'll definitely compromise your immune system. You almost want to just stop eating sugars if you're really worried about your immune system, and if you have low white blood cells, you're immune compromised, you definitely want to get off sugar. And be careful with fruit juices. Fruits are typically okay because there's lots of fiber. So the fiber stops the glucose from being absorbed quickly. So it stops the glucose spike. But concentrated sugars or fruit juices can have an immune suppressing effect. So that's one of the key things you really want to think about. Think about your sugar intake. And what I've seen happen to my own patients is they get in the mode of being just depressed. They're at home, they can't do anything, and they just start eating on a lot of sugar to deal with their bad situation. Okay, so I would say for foods, definitely avoid the sugar. The other key thing we know is having a very diverse microbiome is critical. And when you look at the bacteria in your gut, produce something that are called postbiotics. So you may have heard the word prebiotic or probiotic, but there's something called a postbiotic. So let me explain all these different things. So the bacteria in your gut are produced by eating foods that are called prebiotics, like high fiber foods. High fiber foods allow you to provide the resource your gut needs to populate your gut with healthy bacteria, good bacteria. So that's a prebiotic. Probiotic is something like acidophilus you can get at the health food store. So you could take acidophilus, and that is a probiotic, and it has some effect while you're taking it, some immune enhancing effect for some people with certain gene types, some better than others, based on their overall microbiome health. And then a postbiotic is really what the bacteria make itself, and this is where a lot of research is focused in right now. Your bacteria makes things that are called polysaccharides. And there's different types of polysaccharides. So one form of polysaccharide is called polysaccharide A. And they find that if your gut bacteria makes lots of polysaccharide A, in animal studies, it calms down autoimmunity. So one of the things to really try to do when you have a autoimmune disease and you're trying to improve your immunity is to really diversify your gut. So what that means is you have to eat a high source of vegetable fibers, and not only high source, but a diverse form. So you can't just eat cabbage all day if you like cabbage, or carrots all day. You really want to mix up different types of vegetables, and the diversity of the vegetable fibers will diversify your gut microbiome. Studies have shown that one day and up to 3 days, especially 3 days of a high, rich, diverse fiber diet can change your gut microbiome. So one of the best things to really do is to diversify your diet with lots of different vegetables. And you can put those like in a Vitamix, like 5 or 10. You can get a bunch of different vegetables and different natural spices, blend them all up in a food processor, put a couple teaspoons in the water, drink it. You don't always have to have a huge salad. You just need to have lots of little plant fibers that you get exposed to. You can take things like psyllium husks to just give you an overall bulking fiber response. But fibers, and especially a diverse fiber, is critical to build your microbiome diversity, which then helps you make what are called postbiotics, polysaccharides, and then polysaccharides can modulate your immune health. The worst thing that you can do is, if you have autoimmunity, is to be so depressed that you're on autoimmune paleo diet, you can't eat anything anymore, so you've given up, and all you do is have the same lunch, breakfast, and dinner. If you're doing that, you will wipe out your microbiome diversity. So you really need to really put a lot of energy into getting a lot of diverse vegetables to support your gut microbiome. That will also support your immunity. Okay. Now, one of the questions I have here is, I wonder why melatonin is bad. So I got a couple questions here on melatonin. I think people are getting a little freaked out about that. Let me say a few things about melatonin. So melatonin, so normally when you look at hormone rhythms, there's cortisol and melatonin, and they have this antagonizing effect throughout the daily circadian rhythm. So normally when you wake up, cortisol levels are high, and as day goes on, they start to dampen. And then when you go to bed, melatonin is low, and as you get into deep sleep, then your melatonin levels start to rise up. And as melatonin rises up, melatonin is one of many compounds that your body makes to activate immune cells, and specifically T cells. And there's been a lot of research on melatonin in autoimmunity, especially with rheumatoid arthritis, because one of the key features of rheumatoid arthritis is that patients with the disease, they wake up with severe joint swelling and inflammation around 3 to 5 a.m. It's a common feature of the disease. And researchers have evaluated reasons for it, and what they find is that they find a direct link to melatonin activating their T cells during those time periods. And they can see those that don't have a rise in melatonin don't have that same reaction. So the reason I want to be careful with melatonin is that melatonin can be a T cell activator. Now, for many people with autoimmune disease, that's not a problem. They can take it and they have no symptoms and any issues. But for some people that have a very aggressive T cell autoimmune response right now, and it's not being controlled, it's not being modulated, it can be a significant triggering effect. So that's one thing to think about. On the other hand, melatonin is one of those things where if I had a chronic virus and I couldn't get rid of it, it'd be one of the things I would consider taking before bedtime to really prime my immune cells. And this is the difficulty when it comes to, well, what do you do? Unfortunately, there's different options for different conditions, and there's uniqueness, personalized approach, and that's, I think, I don't want to be so frustrating for everyone. If you're suffering from Hashimoto's, to go, well, what do I do? Well, I think the best thing you do is you understand the principles, and then think about how your body responds to various things, and then see if that can make a difference for you. Okay, so I tried to answer the melatonin question. Let me see if there's more things here. Okay, what do you think about N-acetylcysteine? So NAC is a sulfur amino acid. It's used to build glutathione. And, the other key thing is there's been some reports of sulfur amino acids being a trigger for some people that have inflammatory asthma, not some inflammatory respiratory disorders. But on the other hand, antioxidants really protect your gut epithelium, your lung epithelium, your blood-brain barrier. So there's a level of uniqueness. For me, I have a lot of hesitation really making specific comments as everyone's concerned for coronavirus, because coronavirus, if you look at the mechanism, actually destroys the lung epithelium, and then the virus then allows the destruction of that barrier, and then you start to cause a cascade of events that then lead into pneumonia. So in some studies, they found that the lung barrier doesn't really break down until you have your glutathione levels depleted. So theoretically, there could be some reasons why having glutathione levels supported by things like N-acetylcysteine or even different forms of glutathione can be helpful. But there's also some contradicting information in the literature where they show glutathione can aggravate some upper respiratory disorders. So where does that leave us? I go, I don't know. So that's some of the questions we have about glutathione and the concerns. So it may or may not be helpful. It may be different for each person, and I don't have a good answer. Again, we're dealing with a virus we've never seen before. Okay, let me ask another question here. Is echinacea safe for kids? Yes, echinacea is safe for kids. And by the way, the reason I mention echinacea is because it's one of the most well-studied botanicals. It doesn't get a lot of attention because it's boring, and because of its widespread popularity, they've made large amounts of echinacea, so it's very inexpensive as well. But again, if you have to be concerned about it being a trigger for you. Okay, I have a question from Heather, I've read somewhere that COVID-19 severely affects glutathione levels. Is there any truth to that? So all infections are going to deplete antioxidants to some degree, and glutathione being the most common antioxidant is one of the key issues. And I think another thing to take in perspective is, when you feel awful, you feel like when you have an infection, like a viral infection, everyone is so focused on trying to enhance their immune function with taking things that stimulate the immune system. But your antioxidant levels are a key factor of how well you recover and how you feel. So antioxidants, like high-rich foods like pomegranate, blueberries, raspberries, even blueberry concentrate, pomegranate concentrate extract, they can really help build your antioxidant reserves. But again, once again, people are in the literature, people out there on the internet are just saying, well, those things can make it worse. I don't know if I agree with that. I think it's really important to really build your immune antioxidant system with superfoods to really help you deal with it. But we don't know how effective it'll be because this is a new virus if you're being specific to coronavirus. Okay. I got a question about, Michelle, can we hear you just speak on the importance of the gut health and how important, how it relates to immune health? Thanks. Actually surprised we are not hearing more all over the internet. Well, gut health is extremely important when you're looking at immune function because, you're having a lot of post-bacteria compounds and bacteria and cytokines really modulate the immune function. And there's been some emails going back and forth with people that are faculty members for the Institute of Functional Medicine, and they're really confused of why the entire world, the internet, hasn't really looked at immune function as a whole body response, the gut being part of it. So gut health is critical for your overall immunity. And I think when you look at the initial, one of the key in the 1900s, Dr. Yashkov got the Nobel Prize in Medicine where he showed taking really high fermented foods improves immune function, that he was able to show that made a big difference. So lots of fermented foods and fiber tend to have a huge impact on immune function as well. So that is something to really consider. So if you don't have a lot of fermented pickled foods, kimchi, lots of fiber in your diet, that can impact your immunity. So that's something to bring up. So that's another good question. Okay, now of course people come up like, what about monolaurin? What about oregano oil extract? What about different botanicals? So this is the thing. Theoretically, these things all have some type of immune enhancing effect. The question is, two questions. Can you tolerate it with autoimmunity? Because it can be an immune trigger. And two, this will actually impact the virus. So there's just too short of a time frame to know what for coronavirus. All we can do is just think about general concepts of nutraceuticals and lifestyle for viruses in general. So technically all those things can have some immune enhancing effect, but we don't know what they are. I just, again, be cautious of people just saying everything is bad. We don't know if that's necessarily true. I think part of it is going to be your personalized approach to how you want to handle your health and your family's health and what kind of things you want to do. Okay, let me try to answer some more questions. Can you touch on the importance of fasting as it relates to the immune system? So fasting is one of these things where technically it can have a huge impact on immune function because you decrease your antigen load because food proteins are antigens and it can improve your immune function. But you have to understand, not everyone can handle fasting. And for example, if you take a person who's hypoglycemic, that gets shaky, lightheaded, and irritable throughout the day, and they try to fast, they're going to get such significant spikes of cortisol that their immune system is going to really wipe out. They're going to get wiped out from it. So that's the problem with just making general statements. So theoretically, fasting, if you can fast and you don't have any significant symptoms, you don't crash and your brain still works, there can be some immune-enhancing benefits from that. But if you're, let's say, you have blood sugar susceptibilities and have tendency to be hypoglycemic, one of the worst things you could possibly do is fast because you're going to get these cortisol spikes and stress responses that will totally shut down your immune system. So be aware of that. Let's see some other things here. Someone asked about coffee. So coffee has lots of flavonoids and antioxidants, and they also help your circulation and blood flow. Um, the key thing with coffee is it's a stimulant. So there are definitely people. So in general, I would say coffee for most people would have a positive effect because it's an anti-inflammatory compound, has lots of rich flavonoids. The compounds in coffee have been shown to really have an impact on the microbiome in a really healthy, positive way. But in the end, it's a stimulant. There's some people who just have such significant adrenal exhaustion that a stimulant will just put them over the edge and they fall apart. So again, there's some uniquenesses and things to think about when it comes to coffee. Now, the other key thing I want to talk about is also hydration. So the immune system does not work when you're dehydrated. So one of the key things, if you're a coffee drinker and you're drinking lots of coffee and tea, especially caffeinated, is that you make sure that you stay hydrated. So when they look at research studies in states of dehydration, immune cells do not function. And it's one of the most important things. So we talk about sleeping, like the key thing you can do to improve your immune function. Hydration is up there. And the key thing with hydration is that you put an effort into staying hydrated. If you wait to be thirsty, to have sensation of being thirsty, that's a problem. If you drink water and all of a sudden feel a lot better, that's a sign that you're significantly dehydrated. So you really want to make sure you take water. Drinking plenty of water is more important than any botanical supplement you can take. Sleep and water would be critical for just making sure your immune system can function. If you're dehydrated and you're taking handfuls and handfuls of supplements, it's not going to do much. So you really need to make sure you're hydrated. Water is important for many immunological and biochemical steps that are necessary to allow your immune system to work. And water is essential for you to have some degree of osmotic pressure and fluid in your blood to allow you to have proper exchange of immune cells through circulation. So you have to make sure that you're not dehydrated. If anything, make some effort to be more hydrated than ever before if you're trying to support your immune system. So I talked about sleep. I talked about supplements a little bit. It's a deep hole I didn't want to jump really deep into. But the third thing to also talk about is movement and how your immune system works. So one of the things to understand is that when the way our immune system is organized is we have different immune surveillors throughout our system. These are called macrophages or antigen-presenting cells. So when a bacteria or virus comes in your body, there's these cells called macrophages all throughout your tissues. And as soon as they sense a pathogen, they engulf it, and then they send for help through different cytokines or messenger pathways. They then bring in things like T cells or helper cells or cytotoxic T cells, things to deal with the immune response against it. But those messenger systems then are sent into your circulation, and those messenger systems will then be sent to your lymphatic system, and in your lymph nodes you have all those immune cells waiting to figure out what to do. So without proper movement and motion, you can't get proper lymph activity and get the immune messengers for your infection throughout your immune system very well. So when you actually move and contract your muscles, you're actually pumping out your lymphatics. And when you move, you also increase your heart rate, so you improve your circulation and blood flow. What that means from an immune perspective is that when you have movement and motion, having muscle contractions, and you're also increasing your heart rate and improving your blood flow and circulation, all these immune messengers that the immune system needs to integrate and communicate the proper immune response becomes more efficient. So if you're sedentary, dehydrated, eating the same diet every day, and not getting sleep, you're doing all the wrong things. So you want to get plenty of sleep. You want to get some motion and movement, like a brisk walk would be fine to get your circulation and blood flow going. But the more body parts you can move, the better to get the best effect of your lymphatic and circulation system. So you really want to make sure that you are getting some kind of movement. Now, when it comes to exercise, one of the key things you have to realize is that exercise produces free radicals. So you got to figure out what your personal tolerance is to exercise. If you have a very severe autoimmune disease, you may not be able to handle much exercise. If you're fighting an infection, like a viral infection, you got to be careful how much exercise you can do, because it also increases your free radicals. So you got to find the balance. If you're healthy, really getting your heart rate up will be ideal. At the very least, a brisk walk for just a couple minutes can really change your lymphatics. I keep getting this question about LDN, so let me answer this. LDN stands for low-dose naltrexone, and low-dose naltrexone is a medication that has some positive effects with many people that have autoimmunity. And LDN is theorized to work that it binds to regulatory T cells in the immune system and modulates the immune response. And when you're looking at LDN effects with the patient population, what I've seen in my practice is that some patients take LDN, low-dose naltrexone, and they feel no different. Some patients take LDN and they feel a slight improvement. But I just put it to you this way: LDN helps an impact on regulatory T cells, which helps it's more of an immune modulator than it is an immune enhancer. But it's not like a game changer. Most people that have autoimmunity, they take LDN. It's not like they go, oh, I take it, now I'm completely different from this point on. It's just something they've taken and it seems to help. For me, if I had an autoimmune disease, I would keep LDN around for an acute flare-up. If I started, if you start using it every day, what we also see is patients just don't get the same benefits from it. So your immune system does start to not respond to it over a period of time. But there's some uniqueness from one person to the next. Okay, let me read some more questions here. All right, what is the best one? What are reasons that we can't sleep, snap, wake up, run? So reasons you can't sleep, I talked about earlier. Most common ones are like an overactive bladder, too much salt, frequent urination, hypoglycemia. And I tried to give you some strategy about that before. Okay, you brought up that flu earlier and how it's rare to have two viruses at once. With that said, if you received the flu shot this year, would that help with defense against the coronavirus? That's the stuff we don't know yet. We don't know if any type of flu vaccines will impact coronavirus. There was a paper that was just recently published in one of the European Asian journals where they were looking at the incidence of infections in China. And one of the reasons they theorized that kids could be not affected by it much is because they had some degree of immunity from whooping cough. There's an explosion of whooping cough in China the year before, and maybe some of them were vaccinated. It's hard to say if it will have any enhancing effect with coronavirus yet. This is stuff people will do retrospective analysis once we get past this pandemic, and then be able to understand this virus more. It's too early to tell any of those things. Okay. From Claire. Diet like AAP or paleo working on root cause, lifestyle change, lots of valuable info in the files. Great. So that's great. If you're on your paleo diet, you're working on autoimmunity, that's great. There's another key thing to understand. If you're dealing with Hashimoto's, how well you manage your Hashimoto's will be a key factor of how much immune resilience you have. So if you have Hashimoto's and, for example, you have gluten sensitivity, but you can get away with it, you're going to just trash your immune system. If your immune system is dealing with your autoimmune response, it's going to be weakened and it's going to have less efficiency to deal with the virus. So if you know there are triggers for you with Hashimoto's, maybe it is gluten, maybe it's dairy, maybe it is your diet, maybe it's the environment, your lifestyle, your social relationships, the more active role your immune system has in dealing with the autoimmune reaction, the less immune resilience you will have. So one of the key things to just pay attention to, especially if you have Hashimoto's, is really do the best job you can controlling your autoimmunity and know what those triggers are. So be aware of those. Okay, let's go into some more questions. Some of these questions I seem to have answered. So does bouncing in the trampoline help support your immune system? Why not? You're definitely going to pump your muscles. You're going to get circulation, you're going to get blood flow. If that makes you happy, that'd be great. Does exercise mess with your cortisol and keep us awake? So if you exercise, if you exercise above your heart rate and above your tolerance level of fitness, you can definitely spike your cortisol levels. When you actually exercise, you do produce some cortisol and you do produce some free radicals. But after the exercise event, you actually have an anti-inflammatory response that lasts for many, many hours that counteracts those negative responses. So that's where that comes in. Okay. Jan, fasting can technically have an effect. Wait. Can you talk about adrenal health? Okay. So your adrenal glands produce different hormones. One's called cortisol, which is your stress hormone. Cortisol helps break down glycogen, so you have glucose for energy. And then the adrenal glands also produce mineralocorticoids like aldosterone, which help for you to retain sodium. And they also produce epinephrine, norepinephrine, which is part of the stress response. So, the key thing about adrenal health is how do you really define dysfunction of the adrenal glands? And there's lots of different theories and opinions about how to do that. But at the end of the day, the biggest reason people have what are called adrenal imbalances is where they get shaky, lightheaded, irritable. They can't, their blood pressures are really low. They constantly need to salt with food. It's typically because most common cause is because they're constantly hypoglycemic. They just don't eat. They miss meals too often, or they have an ongoing infection or some triggering event. So usually with adrenal health, you have to kind of treat everything else to get the biggest change. Okay. Next question. Does taking ibuprofen or NSAIDs make you more susceptible to an infection? Well, I don't know. I don't think anyone knows yet. So the key thing is like some types of like acetaminophen will deplete glutathione. Glutathione is a key factor to maintain your barrier system, including your lung barrier. Things like coronavirus break down the lung barrier. It's possible high acetaminophen may have a factor, but again, we don't know. I think the biggest thing that's frustrating for all of us is that this is a new virus that's hit the human species, and we don't know what to do about it other than rest and keep our immune systems healthy. But we don't have any specific treatments for it, and that's the problem. Okay. I don't want to give any personal advice. I see a question about asthma, and then personally, there's just too many questions. Okay. Several questions. Okay, what else here? Thoughts on gluten? Don't eat it. Because gluten. Let me explain gluten really quickly here. Because if you have Hashimoto's, gluten sensitivity has a genotype. It's what they call HLA-DQ genotype, human leukocyte antigen gene type. What that means is that how aggressively different triggers activate your T cells. And gluten sensitivity, celiac disease, and Hashimoto's all have similar HLA-DQ gene types. So when you look at the Hashimoto's gene susceptibility markers and you look at gluten sensitivity and celiac, they overlap. So there's a large percentage of people that suffer from Hashimoto's that actually have full-blown celiac, or at the very least have gluten sensitivity. And what happens is when you get exposed to gluten, your T cells, which are critical for you to be able to fight off a viral infection, are now dealing with an immune response. So if you have Hashimoto's, you want to cover your bets. Stay 100% gluten-free if you're dealing with the concerns of a pandemic virus, and keep your T cells healthy to fight any infections that are there versus wasting its time dealing with the gluten immune response. So I would definitely suggest you get tested for gluten sensitivity or celiac. If you have Hashimoto's, it should just be an absolute next step. If you're not sure, it's probably just best to stay off it. It's just a very inflammatory food protein, so be aware of that. Some people say it's too hard. Like, really? It's not. Just do it. Your autoimmune. Here's the thing: what I've seen as a healthcare professional with gluten, they don't see what I've seen. They don't see Hashimoto's patients progress 5 years all of a sudden into brain autoimmunity, into MS, or to other things. And then they wish they could go back and been more diligent with things like being gluten-free. So, it's very frustrating. Everyone does it. It's not a big deal. Please make sure, if you are gluten sensitive, you avoid it. Okay, let me go into some other questions here. Vaccines and Hashimoto's. I asked Pevnar 13, Pevnar adrenal vaccines and Hashimoto's. I don't know if vaccines are going to be the answer for autoimmune disease in general. It's a different mechanism. Time will tell with that. I think they're really looking at more like Treg modulators as the best thing for that. As far as coronavirus goes, they're working on a vaccine. Will it be effective? We don't know. Could it be a trigger for autoimmunity? Yes, it can absolutely be a trigger. We don't know. Could it cause molecular mimicry? Possibly. And these are all the things. At the end of the day, there's going to have to be some degree of overall immunity throughout worldwide. They say that we need about 60 to 80% of people that start to develop antibodies against it before we have issues with it. I think that's very true. We just don't know how it's going to impact Hashimoto's community. Okay. I think I answered most of the questions that are coming up. Okay. I do have a Dr. K News, drknews.com, where I put together articles and information if you would like to learn more about what some of the stuff I've done. And I put together a program that's free, for immune resilience program for all my newsletter followers. And it just goes into some of the things I've already shared with you, how important sleep is, how important exercise is, how important hydration is. Those are key things to look into. The other things so you can get access to that if you like for free. We're not trying to sell you anything. It's just something I made for people that are following my information as an author. The other key thing is that I mentioned in that program that I want to share with you is how important getting an opioid response is with your immune function. An opioid response could be as simple as a hug. It could be a healthy relationship. It could be exercise. It could be laughing. So, one of the things that I will definitely have my patients do when they're immune compromised is really try to encourage them to watch things that make them laugh. For me, I always crack up watching like cat videos or dog videos on YouTube. They're so funny. Or you can have a favorite comedy you like to watch. When you laugh, you actually create a very powerful opioid response that has a powerful immune modulating effect. So, as you improve your microbiome diversity, you definitely want to watch things that really are really good for you. You definitely don't want to spend your entire day freaked out and release all your stress hormones, worrying about a virus, and then just being in a world of fear. That's really going to be really bad for your immune function. So you definitely want to take breaks from that and have some family time. And the other key thing is crying. Crying is also really helpful. Crying is a reflexive physiological response to help you release opioids that then modulate your immune system and block inflammation and help you deal with the physiological stressor. So if you can watch something that's funny and makes you cry, even better. But those are very important things to really think about. So my takeaways for you is, let me tell you the worst things you can do. The worst things you can do right now is stay up late, freak out, not get proper sleep, eat a diet with lots of sugar, eat the same diet every day because there's no diversity in it, let your blood sugar drop throughout the day. That'll make your immune system worse. Continue to eat gluten if you have Hashimoto's because there's such a significant link with that. And if you're doing all those things, you're going to really put your immune system in a state of weakness. The things you can do to really improve your immune function right now is get plenty of sleep, try to get deep REM sleep, stabilize your blood sugar throughout the day, make sure it doesn't drop. If you can handle fasting, great. If you can't handle fasting, don't push yourself and make your immune system worse. Try to watch things that are positive, they have an impact on the immune system. Stay away from all the negative information, and really avoid sugar. Sugar has a very negative effect on the immune system. Anyways, it was a pleasure to be able to communicate with you. Thank you for all of your positive messages, and happy to come back anytime. And thank you again.